Case number 3. A 79-year-old female patient who had fallen at home and got a hip fracture has been operated, and it is the 4th post-operative day. Everything is going well, and the patient has been discharged today with the help of home care. For the medication management, administer medications as per the provided schedule. Ibuprofen 400 milligrams 3 times per day. Bisoprolol 5 milligrams once per day. Paracetamol 1 gram 3 times per day. Simvastatin 40 milligrams once per day. Aspirin 50 milligrams once per day. Enoxaparin sodium 40 milligrams once per day subcutaneously, and pantoprazole 20 milligrams once per day.
So the physical assessment would, of course, we would take the vital signs, the blood pressure, the Verensokeri, temperature, and the respiratory rate on how's the patient. And we have to assess the pain level. Of course, she had gone under through a hip surgery, so we could assess her based on her pain level. And the surgical site, if it's bleeding or if it's tender, you could check it properly. And if there's any wound dressing that's been exposed, we could check on that. And her mobility, evaluate the patient's ability to move, if she's able to move, and how she could go around the room. And skin integrity, inspect for pressure ulcer or other skin breakdown. Of course, hydration and nutrition. And the functional assessment, of course, we have to check the activities of her daily living, how she's doing, and use assistive devices such as rollatory, the cane, walking cane, and other kinds of equipments if she's needed. And lastly, psychosocial assessment on how her emotional state is, especially when she had a hip injury. And and support system, of course, we're there empathetically as a nurse to be with her.
Okay. Yeah, that's a good assessment.
Yes.
Okay.
Yeah, before discharging the patient, yes, it's really important to do overall assessment.
Yeah.
So if the patient then so that the patient no need to go back to the hospital. Yeah, could be managed at home.
What's our main goal?
Yeah.
The plan, we need to plan. So our main goal is to ensure that the pain is managed effectively, especially if the patient complained for pain. You need to give some pain medications, right? And prevent complications such as infections or pressure ulcers. If the patient is maybe we can turn her during sleeping, or if she's independent, of course, she can move by herself.
And because sometimes it's painful for the patient to move by themselves, yes,
Yeah,
that we can
push off.
assist. Yes.
So that she won't be confused, we have to educate her so that she won't be sekaising on what's happening.
Yeah, it's helpful too.
Yeah, and also it's important to provide emotional support and provide health education to the patient and the family.
Yes. Yes.
And the expected outcomes is the patient will report pain at manageable level. The surgical site will remain free from signs of infection, such as checking the wound site if there's a purulent discharge or something.
Like a pus.
Yeah.
Yeah.
And then the patient will be able to demonstrate the safe use of assisted device, for example, rollators or canes, should she need one. She'll be able to perform activities of daily living, like picohilia after the operation. The patient and family will verbalize his understanding of discharge instructions and home care needs. Probably we can do like after the explanation, the patient or the family members can like explain to you what needs to be done. So it's ensured that they understand the instructions.
Yes.
Okay.
Yeah, planning is also very important upon discharging the patient, so they have the guide to follow at home. Yes.